Thank you. I am Tamara Underiner. Thanks for that introduction, and thank you for joining us in our presentation on planting seeds in an interdisciplinary garden. I am the co-founder with my colleague David Coon and some other folks who are joining us here today of Creative Health Collaborations, and we're here to share a little bit about our work towards this framework. And it's based on an arts-based community partnership that we want to talk a little bit about today. This is part of a new project. Oh, this is what else I do here. So let me skip about here. This is part of a new caregiving research lab that's sponsored by the National Endowment for the Arts, which examines the health supporting role of the arts in various caregiving contexts. And the key thing to remember about this work is that it's really interdisciplinary. It looks at the arts and the humanities and the design and the integrative approaches to them to support the health and well-being of individuals and communities. And even if this were only based at ASU, it could get pretty complicated because of its interdisciplinarity, because you have different jargon at work, you might have different project goals at work because of the different players involved, different standards of evidence, competing methodologies, or just different methodologies. And then when you add a community partner into the mix, things can get pretty complicated because they'll have their own backgrounds and legitimate aims for deliverables and deadlines. And so what we want to share with you today is a framework that we're evolving. It's very iterative, so it's still in the works. We'd like to share it with you and get your feedback on it to get everybody on the same page. So before we turn to that framework, I wanted to introduce you to the project itself. And to help launch that, we're going to start with one of our academic partners, Liz Reifsnider. She is a professor at the Edson College of Nursing and Health Innovation, and she's going to talk about the science at work here, but we'll also hear about the art, and that's going to be a real treat for you, I think. And then we'll wrap it up with David Coon, who's going to introduce the framework itself, and we have a little interaction planned for you too, so I hope that you'll enjoy that aspect of it too. So without further ado, let me turn it over to Liz, and I'm going to stop sharing my screen so that she can share hers with you.
Hi. Okay. I finally saw where the mute button was, and I want to display this screen share slideshow. Okay. Yeah, finally I'm here. Sorry about all the technical difficulties. I'm the Nancy Melvin Endowed Professor of Pediatric Nursing at the Edson College of Nursing and Health Innovation. And I've been working for about 6-7 years now with families of children with medical complexity and with professional health staff at Phoenix Children's Hospital, where we're examining how to create better care coordination for these families. And this, our project as part of the Creative Health collaboration has evolved from that ongoing partnership that I've had for these many years. It's been a great pleasure. This particular study is called Play for Families of Children with Medical Complexity. And what we're doing is artful caregiving with child's play theater. We had to do a major pivot with COVID last year. We were planning on having theater in person with families and children. And of course, that had to completely change. And so Korbi Adams, our community partner, will tell you about all that. I'm going to go into the study that we're doing here. First of all, what is medical complexity? Well, children with medical complexity have medical fragility and intensive care needs that are not easily met by existing healthcare models. Children with medical complexity may have a congenital or acquired multisystem disease, a severe neurological condition with marked functional impairment, and/or technological dependence for activities of daily living. These children require a high level of care and a high commitment from their families for making sure that all their care needs are met. This care map was created by Dawn Bailey, who is the mother of a 16-year-old girl with a lot of care needs, medical complexity. And I've worked with her for 6 years probably as part of our collaboration on improving care coordination. She created this map and I'm sharing it with her permission. But if you look down here on the lower right corner in blue, this is what the parent or caregiver of a child who does not have medical complexity, just has what we'd call normal health. The parents have to pay attention to work, school, friends, bills, health, family, there's the spouse, the children, parents, just, daily life is complex when you're raising children. So then if you add a child with medical complexity, then you have to look at school, all of the people that are involved, because you have to be sure that there's a nurse or a health aide looking after your child, that they're getting physical therapy, occupational therapy, psychology, mobility, that's that part. Then there's the Developmental Disabilities Agency, and then there's all of these projects. And then you go to insurance, Altex Arizona Long-Term Care support. So they have to work with their insurance agency, durable medical equipment, because nearly all these children need some type of medical equipment at home. And then you get into the medical issue. And all of these specialists have to communicate with each other. And many times they don't. And so the parents end up, I've seen them carry around 3-ring binders, inches, 5, 6 inches thick, with all of the paperwork they have to pay attention to. It is really complex. So we thought about how can we bring some joy to their lives, because they focus so much on health and illness and problems. What about creating something that could be fun for them? So our study is the research questions. How does participatory creative art making between parents and child contribute to creative openness between caregivers and special needs children? Second research question, does participatory creative art making change the caregiver's perception of their relationships with their children with special needs? We are working through our community partners to recruit families of children with special needs, and they have to give consent to participate. And the child, if they're over 6, has to give assent. And then we have some questionnaires that we're going to be going through with them pre-intervention and post-intervention. So of course, we're gathering demographics just to sort of get a picture of their family. We're using the WHO 5 questionnaire, which is a well-being index, well-being. How do they feel like they're having a good life at present? We're looking at their perceived stress and their perceived stress scale. We're looking at the quality of life scale, if we can improve their quality of life. And then we're looking at the family APGAR. And the family APGAR is a measure of how cohesive the family is. Are the parents and children sort of on sync and see the family goals the same way. So the parents, our initial group of parents, about 5, have filled these questionnaires out, and then we will introduce our intervention to them. And about 3 months later, we'll go back in and do our post-intervention. And we'll see if these, if the intervention will actually improve their well-being and their quality of life, and we hope reduce their stress. And now I'm going to turn it over to Korbi, and she will actually tell you what our intervention is.
Thanks, Liz. Like Liz mentioned, this is a project where we're hoping family dyads of a caregiver and a child have opportunities to create art together or do some playing together, so that there's the potential that those moments of shared creative experience will help to support a well-being across the family unit. In our initial grant, we wanted to do in-person theater classes with family dyads and see if intergenerational art making together in a space promoted that well-being. But then we shifted and we really leaned on our advisory council and our advocate, Dawn, to help us understand what families with medically complex children were going through in this time and what would be something that would be really beneficial to them and not an added stressor. So throughout those conversations, our team came up with Wonder Boxes. Wonder Boxes are a monthly box that's delivered to your house that's created by artists and is filled with activities that are all rooted in a picture book to help explore your world and your neighborhood through art, through an artistic lens. So our first box has gone out to all of our participants. Here's our Wonder Box. It has 10 activities in it. And like I said, they're all rooted in a picture book. So this first picture book is Windows by Julia Denos. And each of these activities really dig into a part of this book and are explored through an artistic lens. We have 5 artists on our team, each using one lens of theater making to create activities for young people to do together. So we have one artist that's rooted in sound design and music exploration, one artist that's looking at environment and setting, another artist that is looking at acting and character work, one that is looking at storytelling, and then another that is creation and tactile things. So I wanted to share a couple of the activities with you today. One of them is about storytelling, and we really tried to make each of these activities accessible. Like Liz said, there's a wide variety of young people that are going to be using these boxes, and so we needed each activity to be able to fit a number of different modalities and a number of different ways of engaging in the art making process. We also heard from our advocates that these needed to be relatively short activities. So everything in the box, each activity can be done in 10 minutes or less, because potentially these families might just have a couple of moments to be able to engage together in something. And we wanted these to be able to be completed and whole in that time frame. But also you could expand them out and keep playing as long as you want to. So one activity looking at storytelling is looking at this page in the book that has this beautiful house that has no one living inside of it. And so thinking about a way of storytelling that could be accessible is we created 3-line stories. So we have a picture prompt with a picture at the front or a prompt at the front that if the child is verbal, they can explore that together. And if they're not verbal, then we have some options for them to pick together of who might have lived in that house. Maybe it's 23 cats, maybe it's a family of robots, a super old woman, or a very large family, and they can pick these by pointing. And then the other participant or the caregiver can tell a story with those characters involved. So that's one exploration. Another is that we have a sound artist that looked at what kind of music making you have in your house. So what are all of the ways in which objects in your house can make sound and music? And they looked at this page in the book that is all of these different houses and windows that we can see from an apartment building, and asked all of the families to imagine standing on the street below that apartment and to pick one of the windows and then find objects in your house to create a soundscape out of like a Foley table that would show what the sounds of that house might be. And then we're going to collect all of those videos of sounds and put them together and make a soundscape of what it might sound like standing in the street of that apartment building, so that we can send that back out to all the participants and they can have some interaction. Another activity that we had is, because that book is all about walking through your neighborhood, and right now that's a very applicable journeying through your neighborhood. Maybe you're not walking, but journeying through your neighborhood is something that is accessible to everyone at this point. So we made a neighborhood scavenger hunt. So there's a number of different things that everyone can walk through their neighborhood and find, and hopefully that will help them to engage in their neighborhood in a different way and see some of the things that we see every day through a new lens. The boxes are out at families' houses right now, the first one, and we're using a Canvas classroom to engage with them on their own time scale. And we're hoping that these boxes are something that bring a lot of joy to families and something that allow them some artistic escape from their daily life. I'm going to pass it off to David, who's going to talk through some of our like bigger picture vision of how we're working through this model.
Thanks, Korbi. Let me share my screen, hopefully here, and get it rolling. Are folks seeing that? Seeing the bigger picture or just the small one? Can people, the small one?
We see your slides and your slides in the stack.
No, that's not what I want. I want.
So if you press slideshow play, there.
Are you seeing the larger one? Are you seeing the larger one?
We see the presenter view now, David.
Still not seeing it?
We see your notes.
Okay. All right, let's start again, because I have it already in bigger. And all right, so I'll do this and do it one more time first and see if I can get this to work. Okay, but when I do it, it blocks out the other screen. So I don't understand what I'm doing wrong here. So keep escaping. All right, I'm going to...
While you're doing that, I'll introduce you as an associate dean and professor in the Edson College of Nursing and Health Innovation. And David and I go way back. He's the co-founder of Creative Health Collaborations with me back in 2015. There we go. Perfect.
Good. Thank you. Thank you. I'm sorry. As my team knows, I'm not feeling very well, and I'm clearly not functioning very well either. So thanks for the opportunity. I'm going to move your all's faces so I can see what I'm talking about here. So thank you, Korbi and Liz, for mapping out this initial project. We have other projects that are coming down, and actually it was built off of a project in many ways that I did with community partners that you saw in the very first slide, if you joined us in time to see the picture of a member of the Phoenix Symphony working in a long-term care facility with people with dementia. So what I want to do is walk you through sort of the team, how we created what we think of as our dynamic process framework, but I'm going to do it in a scavenger hunt. So bear with me. I'm tagging off of what Korbi just said. And you can see you have these different things to sort of collect as part of the model, everything from a magnifying glass that says analysis and findings to partners in planning and a handshake, et cetera. So to use that kind of game approach as we go through this, because it's we think it's important, but after you follow Korbi in that wonder box, it's not quite as dynamic as we'd like to have it be. So anyway, before I do that, part of what Tamara raised at the very beginning is there kind of can be these gaps between what happens in the health research world that's kind of designed to prove, and the community health and planning and program evaluation world that's really about improving. And that's where we often see a lot of our arts programming. And so we're really interested in bringing these groups together, bridging that gap. And it's already begun in a sense, in various ways, but we want to strengthen that. And that's why we use this and develop this creative health collaboration dynamic process framework. And so, for example, I'm going to pull apart these components for you as we go through, because this is a dynamic process, and it's going to encourage, when you're working with partners, it's going to encourage ongoing dialogues. And sometimes those are difficult dialogues by the jargon that was mentioned, as well as people have different goals, even in a partnership. They may have an overall vision that they want to see happen, but what they need as a partner can vary across that. It's an iterative process. It's multi-leveled. It's non-linear, and that's really what we want to say is a dynamic process. And then, as you'll see at the top of this, there are multiple entry points that people can enter. And so, for example, let's say you are working with a community partner that shows up and they say, hey, we want to work with you in something in the arts. I've got somebody in an arts organization, but we really want to target a particular entity. So, for example, you want to target a particular community. Let's say you're concerned about wayfinding in South Phoenix, and you want to create some kind of dynamic partnership to help that community area in a certain block area figure out how to have wayfinding and do that in this partnership. And how does that impact access, for example, to food insecurity? So the next one that I want to do in breaking it down is what we think is the most important, and particularly in terms of this particular conference. It's the cornerstone, the partners and the planning, how we engage partners across the entire process from inception to implementation and dissemination of the project. So on the one hand, we have the framework component that talks about roles and responsibilities and considers these aspects, but also we think that it is important to begin to think about key considerations in terms of questions. We don't have all the questions on there, but for example, just hitting the last one that appears, what are the linkages and exchange efforts that are needed? Now, I want to pause for just a minute and say what I hope you will do. If you've got a pen and a paper or you've got some ideas, jot down as you go through this scavenger hunt, if you're going to have partners and planning, what partners might you have in mind, the project that you're doing? Do you already have a partner? What are some of the linkages and exchange efforts that need to happen, for example? So as we go through this, we hope that we'll have time for a discussion to get some of your comments about this and maybe ideas, successes that you see, or challenges that we might be able to discuss as a group. So the next thing is health priority. So Liz and Korbi mentioned from the in terms of their partnership, really looking at the needs of children with medical complexities and how to address their needs and how to improve their health and their overall quality of life. So when we think about the framework component, it can range from a community level something or a subset of community down to individuals or families, but what is the health priority? We need to define it, and who does it impact, and what's its importance to them? But we really want to do this in our partnership. So what role can partners play in helping maximize the issue for us, increase awareness within within the community or whatever level we're looking at? And then also we want to consider, are there evidence-based approaches or activities that are already going on in the community that we might be able to strengthen our partnership through? Another thing, if you're a scavenger hunt, you're going to collect together your target population. And so again, I'm going to go back to Korbi and Liz, and in this current project that you just got described, we've got kids with special needs and their parents. It's really thinking within that, and probably their whole family. You know, how are their brothers and sisters involved in this too in some way? It's not just thinking just between the dynamic, but how does it move out beyond that? So what's the context in which people live, work, and play? So I love the scavenger hunt, because also getting them you know, out of the house into their neighborhood and thinking about it at that level. So again, how do we think about the context, and then thinking about key considerations in terms of reaching the population? So looking at that second question that just happens to be out there, what are our outreach, recruitment, and engagement efforts that are going to get these folks involved? And then what modes of outreach, thinking about your own projects out there as an audience, what you're interested in, what's the boots on the ground efforts, but what's now on social media. And of course, during COVID, it's a critical component that we have to think about. How do we reach these people, given we're not doing the direct face-to-face that we've done before? So I want to switch now to another part of the scavenger hunt, and that's a little chart up there as the icon. What are the project outcomes and outputs? So again, Liz raised the issues of the quality of life ideas that they're going to be measuring. So what's the physical, mental, social health outcomes? What are the artistic outcomes? But then we also need to flip and think about what the outputs are. So they're different. So we're, you know, what are the outputs are things like the Wonder Box. That's an output. The manual that'll help people in the future be able to do this, that's the output. So there are questions that might go on, but thinking about a project having legs and the output. So this Wonder Box has been developed. Who else might Child's Play do this with? What other special populations or partnerships might this help happen with? And how would that basic idea be tweaked for the future? Project design. So for us that geek out on design, and that's Liz and me, and definitely, we totally get into these kinds of things. What's really needed? Is it everything from an individual case study or case study of a series of families because we're at the beginning of something? Is it a larger epidemiological, community-wide kind of project? And it's going to vary depending on where we are. Is it a pilot study? Have we already demonstrated something? Is it going to be a clinical trial that randomizes people to different groups? And what is it at the individual level, at the family level, at organization or policies, or some combinations of those? But I think it's also important that we also want to think about those outcomes also help shape this in some ways. Are we interested in something like a clinical outcome of reducing depression, but are there all other types of significance, the quality of life indicators, social validity, what are the benefits to the individuals? Sure, they can do the measures, but they're also saying, hey, you're not capturing part of what we're really experiencing. And then there's social significance, and that often comes to cost, you know, provider usage, hospitalizations, whatever might be associated with that. And it's important for us to think about. Analysis and findings, that really ties to what I just said, but also thinking about it from a mixed method viewpoint. How do we learn from one another, from the stories that we're capturing, from a qualitative viewpoint, to also the quantitative kind of outcomes that I was just talking about and thinking about in terms of the importance. So, and then what findings and lessons learned are relevant to the stakeholders. When we're working in a partnership, what's important to Liz and I, and sometimes when we're thinking about it in terms of clinical significance, you know, rehospitalizations, these kinds of things, that may not be the most important kind of thing in thinking about Korbi's interests and her, you know, Child's Play interests. Yes, that's wonderful, but it's also some other kinds of factors and outputs that are most important. And maybe it might even be the kind of legs that something like the Wonder Box might create for them to do partnerships with others. All right. So then I want to end before we open it. I turn it back over to Tamara. The final part of that, and that's a horn, I believe, up there. You know, sometimes, Tamara, I'm going, is that a horn? I think that's a horn or a megaphone that we're thinking about. How do we disseminate and how do we implement? And this is critically important for the current conference. Social embeddedness is so much of what ASU is about and what we do. So how do we think about examining the factors and the processes that lead towards the use of whatever the information that we've gathered or the intervention that we're doing? That's dissemination. How do we get it out there? But also it's the successful integration into particular settings. And that's implementation, but it's also the social embeddedness that's so critical to us. So how do we take the outputs and outcomes, the wonder box, the treatment manuals, the training programs or webinars, and how do we embed that and share that and have that be useful beyond our own project? But it's also then thinking too, where have we delivered stuff? How consistently was it? And how does that apply to others? And then, again, back to sustainability and embeddedness, what environment and community supports with our partners can help us sustain this out there in the community. So I'm turning this back over to Tamara.
Thank you, David. Let's leave that slide up so as a mnemonic there. I do want to invite, we have, I think, 6 minutes left, and I want to invite the attendees to respond in a couple of ways. First of all, if you have any questions about our project or our framework, please, I invite them now. I'm also curious to know what might resonate the most based on your experiences in your university community partnerships that the framework suggests to you about your challenges or your ways you've worked through them. We're really interested to know, about your successes, the knots that you've untied, modifications that you might propose to this. We're interested in that. And third, if you also have worked in these kinds of interdisciplinary spaces inside or outside of the health domain, we're really curious to learn analogously from your experiences. So I guess we would like to hear in the next 5 minutes or so, because we also need to leave some time at the end for a closeout. I really appreciate your attention here and your further thoughts. Thank you so much.